Hi, everyone. My name is Valerie Gribben. I'm one of the pediatricians at San Francisco General. And let me pull up my slides so I can share it with everybody. So today I'm going to be talking about second and third hand smoke, a pediatrician's perspective. And I would like to give a shout out to the folks who sponsor the grant that I'm on that are helping me time and to be able to research this, which is First Five California and the California Smokers Helpline. So I just saw Sharon was on this call and I was like, oh, perfect. So I am a pediatrician here at San Francisco General. San Francisco General is really the safety net hospital of the city of San Francisco. So basically, all of the patients I'm seeing are Medi-Cal, which is sort of for the lower income patients of San Francisco. And I work as a hospitalist. I work overnight in the intensive care unit. I work in the outpatient clinic. And really what I can say is that I see secondhand, third-hand smoke affecting children at every stage of their life in every setting that I'm in. So I'm really honored to be able to speak with you today about why this is such a topic that's near and dear to my heart. So just to talk a little bit about the way that I think about nicotine, it's really surprising, but I think about tobacco as an addiction that happens in childhood. So they've actually shown that nicotine is brain poison for all intensive purposes, especially when you consider that 90% of smokers actually start smoking before the age of 18. So really it's a pediatric illness. And what you see are these like vulnerable teenage brains who these kids start smoking and nicotine hijacks their dopamine pathway. So this is sort of a schematic kind of explaining about when nicotine comes in, all these pleasure receptors just alight in children's brains, and you see that really primes the pump for addiction. So it's no surprise that teenage brains are most vulnerable, and if teens start smoking, they tend to become lifelong smokers. The way that I teach about tobacco and smoking is really as part of a toxic cycle. So as you see, like this kid joins the toxic cycle sometime before the age of 18, and you have to ask, why is this person start smoking in the first place? And what you oftentimes see is that there are larger structural issues that perpetuate smoking. So a lot of times children grow up in lower income homes around cigarette smoke. So even though in the state of California, everyone celebrates because, in San Francisco, all the Google and Facebook tech bros, the smoking level may be down at 10%. But really, when you look in my community, when I look at the children who are screened in my clinic, it's 30 to 40% of children who are exposed to cigarettes. It can be from a grandparent, it can be at the daycare, it can be an older sibling, or it can be a parent. And once someone starts smoking, you actually see these structural forces that sort of push them in to continue the cycle of smoking. Now that there's someone who smokes, it's actually harder to get a job. Once it's harder to get a job, now it's harder to get health insurance. Once it's harder to get health insurance, now it's harder to actually get the quit help that you need. And so then what happens is someone starts smoking and they're smoking while they're pregnant, and then you see that there are long-term consequences to the children who are born, and those children born to people who smoke are themselves more likely to smoke. And what you see is a cycle just run around and around and around. And so what I really want to focus on this morning is focusing on the second and third hand smoke and really emphasizing that there is no safe level of exposure to cigarette smoke. There are more than 7,000 chemicals that are come out when someone smokes a cigarette. And just a few of those: hydrogen cyanide, carbon monoxide, like from car exhaust, arsenic, heavy metals like lead, ammonia, cadmium, and really about 70 of those chemicals have been definitively linked to cancer. So, let's see here. What starts when we talk about the way that cigarettes affect children, it starts when they're still in the womb. If a mother smokes, a child is more likely to have a low birth weight, more likely to be born prematurely, more likely to actually be born and not be alive, and more likely to have children who are of nicotine addiction. Then when you move into sort of the infant era, you see there's a higher risk of SIDS. It's almost double the risk of those who don't smoke. And SIDS being sudden infant death syndrome, where children will just die in the night, usually between the ages of 0 to 6 months. And they speculate that the reason is that when children are exposed to smoke long term, not only may their genetics be a little bit different, but also the smoke exposure actually messes with their receptors to have sort of arousal and wakefulness in the event of hypoxia. So in the event that they're maybe like be sleeping the wrong way, and there's like a pillow near them, they actually have like less ability to sort of like wake up and recognize that they're being smothered. And then in the neonatal first year of life period, they have a higher incidence of respiratory syncytial virus, which sends so many children to the hospital. Then when you see moving into their school years and their teen years, there's a higher risk of asthma, higher risk of ear infections, they have cognitive issues, and children have ADHD. And then when you move into teenage years, now the cycle is really starting to kick up and get into gear. Higher risks of absenteeism and nicotine addiction. And then finally, sort of beyond the pediatric realm, when the adult side, you see these long-term consequences, heart disease, cancer, COPD. So why are these sort of things coming, and why is it so bad for children to be around smoking? And one of the things that they've actually found is the concept of third-hand smoke. So third-hand smoke is basically this residue that remains after a cigarette has been extinguished. So everyone knows that, oh, secondhand smoke is bad. That's why they've banned it in like restaurants in so many places. That's why you can't smoke in movie theaters anymore, because we know that secondhand smoke is exposing folks to those like 7,000 chemicals. But really, the research in the last 10 years is starting to focus on something called third-hand smoke. And what you see with third-hand smoke is the idea that even away from just the cigarette smoke blowing into your face, after a person leaves, after the cigarette has been extinguished, you see long-term consequences that last for months or even years. So if you take a look at this apartment building, this is something that's not unlike, unfortunately, what a lot of my patients live in. If someone is a lifelong smoker and this apartment clearly looks like someone has been smoking, what you see are the walls, they're stained yellow. And what you see there are those white spaces are where photographs or posters hung. And you can see the difference between whether or not the smoke sort of seeped into the wall. The 3 R's that I would like for everyone to remember of third-hand smoke is that it remains, it's re-emitted, and it reacts. So the idea is that the smoking sort of gets into an inanimate object like a wall or a cloth or furniture, and then it reacts with particles. And then it actually has this phenomenon called regassing, which means that it creates this like third different chemical that can really affect on every level, children especially. Why is third-hand smoke so bad in kids? Well, if you think about it, if a parent smokes, their smoke actually sort of, this third-hand smoke sort of clings to their clothing, it clings to their skin. And if you imagine like a newborn infant, a mom is cuddling the baby is right there, so close to that source of third-hand smoke. And it actually is, children are playing on the ground, and so they're going to be crawling around on the carpet, and the third-hand smoke is coming up from that. And so they're just closer to surfaces is the long and short of it is that kids are closer to surfaces that possess third-hand smoke. So the latest research is showing that third-hand smoke damages human DNA, and it is not ethical to do a trial of sort of like comparing making some group smoke and making some group that doesn't smoke and necessarily testing them with humans, but they have done with mice where they've had control groups and they've been testing and exposing them to third-hand smoke. And what they found is that mice who are exposed to third-hand smoke have higher lipid levels, so higher fat levels, poor wound healing, and hyperactivity. And a new paper that just came out actually was saying children who are exposed to smoke, they now think that there might be some links to the development of type 2 diabetes in the long term. This is a new paper that came out, which I thought was sort of terrifying and really illuminating for why this is so important. So I work in the neonatal nursery overnight. And in the neonatal nursery, everything is the most clean. Before I go in for a shift, I scrub my hands, I wash everything off. Things are clean constantly because we take care of babies who are born down to like 26 weeks, incredibly vulnerable children. So we want to make sure there's like no sources of infection. They stay in isolates and incubators. And what this paper actually showed was they looked at premature babies in the neonatal intensive care unit, And then they looked at, after parents or families who smoked came to visit and spent significant amount of time with the children, they actually then tested the infant's urine, and they found in the urine biomarkers of smoking. And of course, people say, well, oh, we've known that for years that you can have these biomarkers of smoking, but usually they assume that the children are getting secondhand smoke. But what this study shows is that this is in a totally sterile hospital environment where no one is smoking. There's no risk for secondhand smoke in my nursery. But what you actually see is that by the handling of the children, by the cuddling of the children, they actually find evidence of smoking in the infant's urine. And when they actually swabbed like the incubators and the furniture where people had been sitting, they found nicotine residue. And that is really the crux of what third-hand smoke is. Remember, it remains, it's re-emitted through this process called degassing, which means that it can actually re-seep out from the walls and it reacts. And so now what can you do to help? One of the things that I always recommend to everyone is calling the Smokers Helpline. I fortunately work in California where they have the California Smokers Helpline, which actually offers guided therapy, kind of helps talk about why it's so important to quit. And then you can do even like an app form. And I always recommend that pediatricians know how to prescribe nicotine replacement therapy. So I say that even pediatricians, even though I don't typically think about prescribing to adult patients, it's actually can be free to parents with insurance even without a prescription. And then a word about vaping is that e-cigarettes and social media influencers, the new trend is vaping. And what you see are Juul and vaping companies really pushing e-cigarettes online. They're paying off social media influencers. They're really finding these ways to attract a younger audience. And the thing that I'll say is that we still don't entirely know what the consequences of second and third hand smoke are with vaping, but we know that it is definitely an epidemic. So you see 20% of high school students are vaping and 5% of middle school students are vaping. And so sort of in closing, I just wanted to say we've had a chance to talk about structural disparities perpetuating the toxic cycle of tobacco, understand the direct and indirect effects of smoking at every stage of life, discuss the dangers of third-hand smoke, and what can you do? You can refer to the California Smokers Helpline or your local Smokers Helpline, prescribe nicotine replacement therapy, and now hopefully you'll be aware that vaping is everywhere. If you talk to any teenager, if they don't vape, they know someone who vapes. And then I'm going to try to see, there are a couple of slides that didn't quite pull in when I was moving my slides through, but this is basically a story of success. When I worked in urgent care, we had a baby come in or a young toddler come in, and we try to prescribe nicotine replacement therapy and connect with CEASE, which is the clinical effort against secondhand smoke exposure, where we refer to the Smokers Helpline, prescribe nicotine replacement therapy, and like do effective jobs for screening for tobacco. And the most exciting thing happened, which was I got an email back from this primary care doctor that said, after she got hooked up with CEASE, she went from smoking 1 pack a day to 1 cigarette every other day, is using nicotine replacement therapy, and already the kid's sensitive skin is doing better, no ear infections, no URIs, upper respiratory infections. And this is a child who is really in and out of the hospital all of the time. So it can make a difference. It's very meaningful. And I just would like to leave on a sort of success note. Any questions?
That's great. Thanks so much, Dr. Gribben. That's awesome. It was a great presentation, helpful, and I love the success story. We love that. So I'll open it up now for questions from the group. Any questions?
Valerie, this is Bob Burns from the National Center for Health and Public Housing.
Hi.
And I'm just wondering if, docs and providers and health centers around the country want to get a look at some information on your program with the idea of perhaps replicating it elsewhere. Is it just, should they just go to your website or give you a call or an email? Or?
Absolutely. I mean, feel free to email me. If you go to this website actually is what got me interested in this. When I was a pediatric resident in training, I didn't actually get any training in secondhand smoke, third-hand smoke, and it wasn't until I sort of pieced things together when I heard doctors talking, and it wasn't until I got involved with Cease California that I started really learning the science behind it and learning how I could be empowered. And I would definitely refer people to ceasecalifornia.org. There are video modules you can watch that outline some of the things that I talked about. There are quitting materials. They talk about what's covered and not covered by insurance. There are ways to refer people to the California Smokers Helpline. So I would definitely start by checking out the resources there, but certainly email me. I love to have partnerships across the country.
So Valerie, this is Steve Schroeder out in San Francisco also. Great presentation. Question for you. How easy is it to detoxify a room that has third-hand smoke residues in it?
So I was doing some reading for this presentation, and the sort of terrifying thing that I found was that it's incredibly difficult. So depending on how long someone who smokes has been living in that apartment, it can really seep in deeply. So when I was looking at, they recommend, for example, like taking up, they remember like taking up carpets, anything that looks like yellowed, taking up carpets, replacing like shower curtains, those sort of things, but like cleaning and scrubbing everything. But even when I was looking at it, even when they paint over that room, that yellow room that we saw, even if they paint over that, it actually does not prevent like all of the readmissions. It's still happening. It's still seeping through the paint. And I actually had a patient that I took care of at the General who had incredibly well-controlled asthma, was doing a great job, super adherent parents, just like delightful. And unfortunately, they lost their apartment. Things are rough in San Francisco, and so they moved into another apartment. And this child who had been so well-controlled, had not ever needed to be hospitalized, started coming in again and again and again to clinic with like very severe wheezing, very severe asthma exacerbations that were just totally uncontrolled. And when we really dug in and started talking to the families about what changed, because nobody smoked at home, like the parents gave the medicines every day, we actually found that they moved into an apartment where someone had smoked for years. And the mom was describing like the walls being yellow and how you'd still sort of vaguely smelled of smoke when she walked in. And eventually the family actually made a decision, because the child got admitted like 3 times and had to get steroids, had to be put on continuous albuterol. They actually moved apartments again, even though it was much farther away and like much more inconvenient for the family. They made the decision to move apartments, and I'll just say I haven't seen the child represent for asthma symptoms since then.
Oh, that says a lot. I mean, that's so like you said, terrifying and awful, and really says a lot about this group and a lot of other public housing communities across the country are working on implementing smoke-free public housing. And so that's part of it. We talked about the secondhand part, and the third-hand thing is, I think, really something that we sometimes forget about or don't. It's not top of mind for everybody. So we're really glad to have this time to think about it more and the impact there. Are there other questions from the group? There's one in the chat I'll say in a second, but are there any other live questions anybody wants to ask of Dr. Gribben?
Valerie, this is Bob Burns again from NCHPH, and I'm just wondering, do you have regular interaction with the Housing Authority, because you're so knowledgeable on how detrimental the smoke is to folks? And
Yeah, I work with the Department of Public Health. So the Department of Public Health in San Francisco has been really proactive. They're doing a lot of really innovative programs, including actually partnering with the California Smokers Helpline to get free materials, like free like nicotine replacement gum and lozenges, be able to like sent overnighted to families if they sign up for the quitting program. That's a great question. I think that that's something that I'm moving more towards in the future, because the more I take care of these individual patients, I'm definitely realizing the effect of public policy and how it can create real meaningful change in San Francisco. I will say I was incredibly thrilled that we were one of the first cities to ban the sale of flavored tobacco products, because I can certainly, or flavored tobacco vaping products, because that is a policy change that I think I've already seen in some of my teen patients with how prevalent vaping is in the community.
In San Francisco, it's mostly RAD, so it's sort of decentralized now.
Yeah, that's a great question. Yeah, that's great. Yeah, we're really following closely the Juul flavor ban in San Francisco. We're here in Atlanta here, but it's we're definitely on our radar too. There's a question in the chat about nicotine replacement and how you handle tobacco cessation and nicotine replacement for your older pediatric patients. Would you just comment on that for us?
Absolutely. So the American Academy of Pediatrics actually released a guideline saying, and they actually, the AAP, which sort of does the guidelines for pediatrics, has great tobacco position papers. They have one on juuling. They have one on secondhand smoke. They have one on sort of like social and economic disparities regarding smoking. And what the paper recommends is that if you have a teenager who is completely addicted and is really sort of like an everyday smoker, you are allowed to prescribe nicotine replacement therapy. So you have to check that the person is not pregnant. You have to screen for headaches. You have to do a medical assessment for them. And then you are able to prescribe for older teens. What I'll say is that tends to be much older teens. More of my younger teens sort of are social smokers, and they maybe smoke like a few cigarettes here and there. And I think of that as sort of like the canary in the coal mine, because what I definitely see with my teenage patients is it starts out as just social smoking, and it really evolves into, once they're hitting college, once they're starting their first job, that's when sort of like the daily addiction sort of spikes, because the teens are starting to use smoking and associate smoking with stress relief. So most of my younger teens aren't the everyday pack-a-day smokers, though the vaping is a whole different story, but they're not everyday pack-a-day smokers. So usually with them, through referring to like the Smokers Helpline, which does help those under 18, involving them in text to quit programs, where they can actually text message and get like like culturally appropriate teen messages back. I like signed up as a teenager for one of these like text to quit programs, and it was this like kind of different teenage voice as opposed to this very dry clinical voice. So it's very interesting. I try to get them involved with like text to quit programs, the California Smoker Helpline. You can text quit now to their phone number. And my teenage patients like that. If I have it in my cell phone, like the numbers, and I'll just say, let's text them together to look to quit. And so if we can do a lot of behavioral health, like behavioral interventions, I tend to not have to prescribe NRT for them, but I definitely prescribe it for their parents who are addicted.
That's great.
Becky,
Thank you. Go ahead, Frank. Yeah.
This is Frank. So I wanted to add two things on the behavioral side. What I've found, and some of my colleagues have found, is you emphasize two things with teenagers. Number one, they simply don't believe that it's addicting. And that is really something that you really need to focus on with them, much more so than with adults. But what I found to be the most effective was this whole idea of teenagers naturally wanting to be independent, and they don't want their parents or other adults telling them what to do. And if you frame the cigarette as taking away their independence because you're addicted, that does seem to be a really good message and something that gets through to them and something they understand.
I think that's a great idea. And I think it's very true. I've had success when I try to talk to teens, especially really sort of having them think through that they're sort of a pawn in the cigarette company. And if you look at like the Truth programming, Truth is actually, the Truth Initiative tries to actually expressly distance themselves from physicians because they want to be like young and cool, but they sort of basically emphasize that if you're smoking, just like that you're basically doing what big tobacco wants you to do. So trying to help encourage them, like think through it and do a lot of motivational interviewing about how they're spending their money can be very helpful. But that's a great Jedi mind trick to think about emphasizing their independence by encouraging cessation.